name's Anya, I'm the acting ward manager on Redwood Ward at Park House. We're really lucky in Park House to have wards where we work with brilliant teams, we've got amazing staff who care so much about the service, so much about the service users, but we do have a lot of difficulties with our environment. So one of the main difficulties we do have is the fact that we have bays, so we have 4 service users in each bay. Obviously when you come into hospital it's a really difficult time and it is a really difficult experience being admitted into a bay, so that's something we really do struggle with. Another issue we do have is just our ward spaces, so we really want to involve carers, we really want to be able to facilitate visitors on the ward and involve carers in people's care basically, but we don't have family rooms, we just kind of have our activity room. It's quite a busy environment, so we've found that our service users would really benefit from having family rooms and having space available where they can have some more quiet time away from other people.
Hi, I'm Leanne. I work on Laurel Ward at Park House. It's 23-bedded male acute ward. We've got 3 single rooms and 5 dormitories. We've got an amazing set of staff that look after our service users on a day-to-day basis, but we do come across some challenges with our environment. One of the main challenges is the dormitories. Sometimes we have some really disinhibited patients and that are quite unwell and chaotic, and to put the service users in a dormitory with 3 other people sometimes is really difficult, and we have to use observations sometimes, which could be avoided if we had single rooms because they would have their own personal space and the ability to have some private time in their own area. Our staff members use great de-escalation skills a lot of the time, but obviously incidents do happen where we've got quite challenging service users that have got differing views in the same dormitory, and that can cause conflict often on our ward. We have got a garden space outside, but for 23 patients our garden space isn't very big, and also there isn't a lot in it. Our service users are male and they often say they want to see like gym equipment in there, like exercise equipment in there, something that they can do on a day-to-day basis to keep themselves entertained and distracted from what's going on with their mental health. And we would benefit massively from quite a nice interactive garden space that our service users could enjoy.
Hi, I'm Nicola Dalton. I've been a service user at Park House on Poplar Ward 2 years ago. When I was a patient, unfortunately I was in a wheelchair due to a serious incident. I'm now a peer mentor on Poplar Ward. I've been here for 1.5 years. I decided to come back to Poplar because I really liked the enthusiasm and the empathy of the staff and the way they work together, even in a difficult environment. But unfortunately the difficult environment had a really negative impact on my stay. So the dormitories really aren't ideal, and being in such a difficult situation, I'd just had a really bad episode of psychosis and I was having to share a room with 3 people that I didn't know that were also really unwell. So not only was there no privacy and the issues with me having to get staff to get me up and down to go to the toilet, there was the other people coming in and out, me wondering what the noises was, other patients trying to take my stuff. It was really distressing on top of the already distressing situation. When it became time to have some leave, there was also extra difficulties because the accessibility to the actual building was extremely un-wheelchair friendly. Because it's on a little hill, either way you go out, you're having to climb up or go down a hill, which is really dangerous. You've got the cars parked on the pavement, really high pavement, so you can't even just easily get up and down the pavement. So even getting outside away from the building for half an hour was impossible. Another issue was my children weren't able to visit me because children under 16 have to go into the family room, but the family room is used for visiting, obviously, for all the other patients, and as well there's sometimes team meetings, so if your family turn up and someone's in the meeting room, you can't see your children. So a lot of people, including me, couldn't see their children.